I'm Melissa Waddell. I'm a nurse practitioner at Atlantic GYN. This is Emily Nobles. She is also a nurse practitioner here at Atlantic GYN. And we're going to show you how to insert an IUD. IUDs are intrauterine devices that are used for birth control. They can range from 3 to 10 years of length and time you can use them. Some will take your cycles away completely, others will just shorten and lighten it up, and others have no hormones in them whatsoever, so your cycles will remain how they are normally without birth control. This is the example of the Mirena IUD, which is now good for 7 years. It does have hormones in them to lighten your cycles up. This is going to simulate our uterus. And then we have a couple of other devices. This is a tenaculum. This is the device that holds the cervix still, so that way we can insert the IUD with ease and try to do it as fast as possible to keep you out of as much discomfort as possible. It does pinch onto the cervix. It does cause a cramp. So that is part of the thing that causes some discomfort. We have some cervical dilators. Sometimes the cervix doesn't open up as wide as we need it to get the IUD to go through, so we might have to slowly, gently open the cervix up a tiny bit. And then we have a uterine sound, which has markers on it for us to know how far deep into the uterus we are, so that way we insert the IUD in the proper place. The IUDs all come with strings. Well, we call them strings, but they are kind of a cross between fishing line and wire. They're not really either material, but they kind of resemble both. They're packaged straight, so when it's first inserted, you might have a little bit of the string poking you for the first few hours, but it bends over and curls out of the way from the cervix, and that minimizes any discomfort that the patient will have. So the first thing we do is clean the cervix with betadine. We don't want to introduce any of the normal vaginal bacteria into the uterus. The uterus is sterile, but the vagina is not. So we don't want to cause infection by transferring that bacteria into the uterus with the IUD. So we clean the cervix, then we hold on to the cervix by pinching on with this tenaculum, and then we can slowly tug and pull the cervix straight. The normal natural body, the uterus is either tilting forward or tilting up or tilting backwards. We want to flatten it out so that way it makes it easier for us to insert in a straight line versus trying to go around a corner. So we hold on to the cervix, we take our sound and we place it gently into the cervix all the way to the back of the uterus, and it tells us a little number here to know how many centimeters that distance is. In this case, we are at 7 centimeters, which is a common average number for a lot of women. So as well, the IUD inserter has the same markers on it, so you move your little dial down to the 7, and now we are ready to insert the actual IUD. The IUD we insert in, if we kind of feel some resistance to the right or the left and we haven't got to our mark yet, you might just need to rotate the IUD 90 degrees left or right to get around that little cleft that is right at the juncture where the cervix and the uterus meet. Then you rotate back once you're past that cleft, back to the top, and go all the way in. With that, now that we're in, we pull our marker tablet back halfway. That will deploy the wings to open them up in the uterus, and then we push it back a little bit further to get it to the top of the uterus and pull the tab all the way. That actually empties the strings, and we pull the IUD out, and we have the strings that we just need to gently cut at the hymenal remnant. If you cut them too short, your partner will complain about being poked. You may also feel the strings poking you, and there's a chance of the strings going up into the cervix and us not being able to find them as a provider. If we cut them too long, that will definitely cause discomfort. So if you cut them right at the hymenal remnant, that is usually the best place to have minimal discomfort for each partner. And that is how you put an IUD in.